Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond turns the tables and interviews me about a topic that has dominated headlines recently, booster shots. Let's listen.
My co-host, Josh Sharfstein, thanks so much for joining me.
Good to be here, Stephanie.
So let's start with a really big picture question. What is a booster shot? Is it just a third dose of the same thing we've already had, or is there something special about it?
Well, for the Pfizer vaccine, it is the third dose of the same doses that have already been received. My understanding is that Moderna may be looking for a smaller dose for a booster shot.
So talk to me about the news that we've been hearing. So the booster shots are now approved for some people. Can you talk me through who?
Well, technically, they're not approved for anyone. They're authorized, which is a definition with a distinction. An authorization is the emergency use authorization that can only be done during a declared emergency like the pandemic. And it reflects that there's not the same level of evidence that you would expect for a full approval. But the evidence is there and has been reviewed by the advisory committee to FDA, the FDA professional staff, the advisory committee to CDC, and now the CDC director. So all that adds up to a recommendation that some people should get boosters and that some people may receive boosters. The people who should get boosters, according to the CDC, are people who are 65 and older and residents in long-term care settings at least 6 months after their first couple Pfizer shots. And then also people 50 to 64 with underlying medical conditions. The may get boosters include people who have underlying medical conditions in ages 18 to 49, as well as people 18 to 64 who have occupational exposure to the virus, such as people who work in healthcare settings.
Mm-hmm. Teachers too?
I think teachers are considered potential occupational exposure. So again, that's a may, not a should.
Mm-hmm. And what's the difference?
I think the difference is that the CDC is saying, consider your own risks and benefits. You know, the evidence is there that there may be some benefit and you can decide. Rather than should, it's more of a recommendation. You know, somebody who's in a long-term care facility, a nursing home, probably should get the third dose 6 months after their first 2 Pfizer doses.
So my mother wanted me to ask you this. She had Moderna in January and February, and so did my father. And they're freaking out because they want to get COVID boosters, but that's not authorized for Moderna. What should they do? Should they get the Pfizer? Should they wait? They say all their friends have lied and said that they were just getting new first doses just so they could get in line. But I'm curious what someone like my folks should do.
Well, there is some evidence out about the Moderna vaccine and the protection being quite durable, and that in fact, the protection for hospitalization appears in some studies to be stronger than the Pfizer vaccine. And so they're getting an awful lot of protection. I think that's one of the big picture points that all this discussion about boosters has really elevated, which is there's a lot of protection people still have. This is not a desperate situation like at the beginning when people were unvaccinated. The difference between 0 vaccines and 2 vaccines is a huge difference. The difference between 2 vaccines and 3 vaccines is kind of a much, much, much smaller difference in terms of your level of protection. It's just so important for people to get those first 2 mRNA shots in if that's what they're doing with Pfizer or Moderna. So in general, what we understand is that Moderna has a booster plan that FDA will review in the next few weeks. And that will be based on data from people who had the Moderna shots. And running out and trying to get a Pfizer booster after having gotten Moderna. There's not a lot of data to support that right now. So most people would say it's better to wait. But there's not a lot of data saying that that's unsafe either, So it depends a little bit on, how people view the situation for themselves. My parents got Moderna and I am telling them to wait. But that is, based on the fact that I think it'd be better for decisions to be made based on data that the FDA has looked at.
I guess if someone were to go out and get a Pfizer on top of their Moderna, they might miss out on the opportunity to get an updated Moderna shot, or they might have something else coming down the pike for them.
In theory, that's true. Is it possible that if you get too many shots too quickly that there's a problem here, or that there's a risk of an adverse effect? It's possible. I think it's good to stick to where the evidence is, because then you have a basis for feeling confident that things are going to go well. But, there may be unusual circumstances, and your mom could obviously talk to her doctor about it.
So will we need a fourth shot in the future? I mean, we've come from thinking we were going to be fine with 2. Now some people need 3. Are we going to have to keep getting boosters similar to getting a new flu shot every year?
Well, what's interesting here is that this is not like a new flu shot, in the sense that when we get a flu shot every year, they're actually changing the strain that's in the flu shot. When we're talking about boosters now, we're talking about essentially the same targets in the vaccine. They're not changing the strain of the coronavirus that the vaccine is targeting. So I would say there are really 2 questions. The first is, because of waning immunity, will we need to keep getting shots? And the second is, because of changes in the virus, will we need to keep getting shots? And as far as waning immunity, it's really hard to say for sure. There are definitely some people who are experts in the field who say there are a lot of 3-shot series for vaccines, and 3 shots really can give you a very long period of protection. And so it may be that it's not necessary to get more shots than 3 for that initial strain, or at least not for a long time. A little bit of this has to do with what we're expecting the vaccine to do, because it appears that, getting a booster increases the antibodies for a short period of time that really protects against much more of the mild to moderate disease, while leaving a long tail for prevention of hospitalization or death. If we're expecting the vaccine to keep the antibodies up, then there may need to be a lot of boosters. But I think eventually we won't be putting that kind of expectation on the vaccine. I think right now, because there's so many cases, we have 2,000 deaths a day, people really want to get the benefit of not even getting mild disease now. I think in the future, that will be less of a factor if overall the burden of disease is less. Then there's this whole other question of, what if the virus changes? Do we need boosters? And the answer to that is, it depends on what the virus does. If we have a virus that really can escape the vaccine, and effectiveness for hospitalizations goes from where it is now, like 90% plus, even 6 months later, if that goes down to 50%, 40%, because it's a different strain, that's a totally different reason to get a booster. And I think that could happen, but it is all up to the virus.
And I imagine there are some companies out there that are looking for something that's specific to the Delta variant.
So they are. The thing is, the regular vaccine is quite powerful against the Delta variant. So I don't think it's likely we'll need a vaccine just for the Delta variant. I think that situation would emerge if there's a variant that really the normal vaccine doesn't work for.
So some people have complained, I think WHO the loudest, that the US shouldn't be giving booster shots until the rest of the world is fully vaccinated. And I'm curious your thoughts on that.
Well, the number of doses the world needs is way, way higher than the number of doses that'll be given as boosters in the United States. And so I do think that given the scale of the pandemic in the United States, we still are leading the world in the pandemic. It's just really terrible what's happening. 2,000 deaths a day is a staggering number. I think it's understandable that people here are trying to follow the evidence and what can be done to reduce the pandemic's effect. But At the same time, I think that WHO is right that there has been far too little attention paid to the global need for vaccines. And you can start to see the Biden administration doing a lot more in this area. And I think that this is going to be really the question for the fall and into 2022, because we're not safe anywhere in the world if the virus can just continue to spread around unabated. That's how you get worse variants. But also, I think that just pure equity issues, the unfairness, the fact that there are healthcare workers dying in other countries for lack of vaccine, it's just going to become more and more apparent. So personally, I'm of the view, not only should there be, major donations of vaccine, but also we need to really build manufacturing capacity around the world so that regions can be able to produce the vaccines that they need.
I realize that we have not talked about the third vaccine, which is J&J. There also is no booster for them yet. What is the future there?
Yeah, I read an article that people who got J&J are now getting used to being left out of the conversation. So I'm glad we're not doing that to them here. Johnson & Johnson obviously was, their marketing pitch was that it's one and done. Turns out probably won't be one and done. It's, I think, quite likely when the FDA is able to look at the data that they will be recommending another shot for people. And in part, that is because of a study, a well-designed study that Johnson & Johnson did showing that the protection was much greater with 2 shots. So it's sort of like a booster, and it's sort of like just improving the results of the first shot. So I would imagine that's going to happen in the not too distant future if that report is true.
So we're talking about booster shots and people clamoring for a third dose, but we have a lot of people in this country and around the world who still haven't gotten a first dose. So what do we do at this moment with the unvaccinated? Is there any path forward that you can see that we haven't done yet to get people to get those doses?
So that's a really important question, because I said before that the difference between being unvaccinated and being vaccinated is huge in terms of protection for COVID. The difference between being vaccinated and being boosted is small. So if we really want to have an impact on 2,000 people dying or on not having another surge in the future, one of the most important things we can do is helping get the unvaccinated vaccinated. And I'm actually a little worried that all the excitement about boosters could distract attention from that. For example, at the level of a health department, it would be the wrong thing to do, I think, to pack up all the outreach clinics and just, shift everything to a mass vaccination site for the people who want the booster. I think it's really important to continue with the outreach. I go out with the Baltimore City Health Department at least a couple times a month, sometimes more frequently. And I'm always struck that there are people who wander into the supermarket and go like, today's a good day to get vaccinated. And it's like, well, why haven't you been vaccinated before? And they say, I had a lot of questions, but now that I'm here, I was kind of waiting for it to come to my neighborhood. Those are some of the exact words that people will use. And then they're ready to get vaccinated. Or some people now say, I need it for my job. I probably should have gotten it before. I know it's a good idea. I've been putting it off. So, as much as we hear about people who think it's in our salad dressing or something, which I actually think is one of the conspiracy theorists is saying out there, there are some people who have some bizarre ideas about the vaccine. There's still a lot of people. I certainly have met a bunch who, are ready to get vaccinated when it's right there in front of them. And the more we can do that, you're really protecting people and protecting the community.
What I saw actually that the health department is also doing is they say, call us, we'll come to your house, which I think is wonderful.
Yeah. They have a delivery option in Baltimore. They're out in different communities. They're going further and further to find different partnerships. I think you have to keep going, and I also think that we have to find ways to fight this misinformation. I mean, we can joke about someone getting up and saying that they're trying to put the COVID vaccine in your salad dressing, but it's not funny when people really believe that. When I'm out and vaccinating and I try to be like as nice as possible approaching people like, hey, might you be interested in the vaccine today? There is a clear percentage that look at me kind of angrily and say the exact thing, which is usually none of your damn business. And I feel like that is a message that they're getting, and that's the right way to answer that kind of question. But, you wonder what is behind that and what misleading information they've been given. And not all these people look like they're at low risk for severe COVID, and so you worry that they could be some of the people who suddenly have to confront the consequences of misinformation when it's really too late for them to get the vaccine.
Yeah. I have one last question, which is totally unrelated-ish. Pfizer has announced that they have good evidence for first doses for 5 to 11-year-olds. I'm curious how soon we might see the little ones getting vaccinated.
Well, it's certainly good news that Pfizer has made this announcement about the vaccine in kids 5 to 11. I do think it's still very important for FDA to do its thorough review and analysis. You may know that Pfizer asked for a full license for the booster, didn't get it. The Pfizer view of the data wasn't exactly the same as the FDA's view of the data. It's really important in this country for people whose job it is to protect public interest to review the data and to get good outside input and to make good recommendations. So, I would personally withhold judgment until I see what the career scientists at FDA think. But certainly this is going to be at the top of their pile. They're going to do this right away as soon as the submission comes in from Pfizer. And hopefully they'll share, their analysis of the data because people will really want to understand what's known and what's not known. I would imagine that this will be an emergency use authorization, not an approval. So again, there'll be a situation where the agency will have to explain what the basis in terms of the data is for a decision, what's known and what's not known, and we'll have to do a lot of surveillance and monitoring with the first sets of doses going out. I would imagine the studies have thousands of kids in them, but there are potentially millions of kids eligible. So it's just really important to do close monitoring when the scale-up happens.
Josh, this was a great conversation. Thanks so much for joining me.
Anytime, Stephanie. Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.